go visit your primary care physician, you'll probably be interrupted within an average of about 18 seconds of trying to explain why you're there. Why does this happen? What's going on? Hello, I'm Dr. Stephen Schimpff. This is part of a continuing series on the crisis in primary care. Last time I talked about the shortage of primary care physicians. Today I want to talk about the importance of listening. Listening is so critical, and the problem is that doctors only have about 8 to 10 minutes to talk to you. 8 to 10 minutes to find out why you're here, to think through what the issue is, to figure out a treatment plan, and then to discuss that back and forth with you. That's not a lot of time. And we talked earlier about the fact that that's due to our reimbursement system and the rising costs of overhead in the doctor's office. It forces them to see more and more patients per day in order to meet those overhead costs. Well, if you can't listen to the patient and take enough time, and you can't figure out the problem within that 10 minutes, and you don't have more time, then you refer the patient to a specialist, and that's really become so very common. But if there is time, so much more can be done. And here's a patient story that might kind of bring that together. A physician that I interviewed many physicians in the process of developing my thoughts on primary care. Anyway, this was a physician who used to have this type of sort of production line office, and he just couldn't stand it. So he changed his practice in such a way that he now sees only 8 to 10 patients a day instead of 24 to 30 patients a day. This means he can give each patient the time they need. Anyway, a patient he'd known for a long time came in with a relatively straightforward problem. But as he listened to her, he sensed that something just wasn't right with her speech. It was very subtle. But he'd had years of experience, and he just knew in his mind that there wasn't something quite right. Anyway, he did a very thorough history, very thorough exam, a neurologic exam, couldn't find a thing. But still, he was concerned. So he decided he wanted to have an MRI of the brain done. So he ordered that, but of course the insurance company said, no way. No way, because you've got a negative history and a negative exam. This is just foolishness. Well, it took him an hour on the phone. He worked his way up the ladder and finally got to the senior medical director of the insurance company. And maybe just because the folks at the insurance company were now, they'd heard enough of this guy, and they said, okay, do the MRI. It's going to be negative. So they did the MRI, and what did they find? They found a tumor, cancer, a primary lymphoma. Treatable, probably curable, since it's still small. So the message, of course, was he knew his patient well, but he had time. He had time to listen to her and sense that there wasn't something just quite right. And he had time to chase after the insurance company. In another setting, that wouldn't have happened. Doctor wouldn't have spent the time to get that MRI approved. So there's the message. There's the message. You need time, and when there's time, it can make a huge difference. I think he probably saved her life. If you don't have time, then you don't listen. There was a study done of primary care physicians where they placed an observer in the exam room and just watch from the corner. And the patient would come in and start to describe why they're there, what the problem of the day was, and on average, the doctor interrupted within 18 seconds. 18 seconds. That's not a lot of time, but that's the pressure that the doctor feels under. Right or wrong, that's what they have to do in order to move things along. It's a remarkably sad commentary on what's going on in our system, and it's why I call this a crisis in primary care. It's the problem. Anyway, next time, I'd like you to consider this question. Are you your doctor's customer? Seriously, are you your doctor's customer?